Today, we'd like to talk to you about a patient who came to my clinic. She's a woman of 68 years old, and her first complaint was very bad itchiness on the whole head, mainly scalp, and the belly. She has it for about a year, and she has tried everything, and nothing could help her, nobody could help her. And she says it bothers her daily, and if there is sunshine, it's even worse. But the whole day she keeps on wanting to scratch her head or her belly. But the main problem is on the head. That is where it's the worst. She also have a heavy sensation at the stomach area. She has it for 10 to 15 years. She feels like it's a big oppression on the stomach area. She also complained about a ball on the left side of her neck. It has been there for about a year. She doesn't know what it is. Some people told her it might be a salivary gland. Some people told her it might be the thyroid. Nobody could really help her on that. The only thing she can say is that it bothers her to swallow, and it's related to emotions. If she has an emotion, even happiness, even a positive emotion, then it's difficult for her to swallow, and she feels she has to drink something to bring humidification to her throat so that she can swallow better. She also complains about an overall difficult digestion with bloating, slow digestion, and especially it's difficult for her to digest when they are dairies or greasy food. So that's how she came, and I could feel a patient very tight, very tense. We had some discussion, and I could understand that she has some frustration regarding relationship with one of her children. Her pulse was also tight and wiry. So my first impression of that patient was really the tightness. So I went for the wood element that I diagnosed as being imbalanced, and I preferred, of course, to use a Jing Shaoyang pattern, which has all wood meridians, and the idea is to balance the wood, even though of course the diagnosis is more an excess part, but I wanted to have a more balancing effect. That's why I choose at my step 3 meridian conversion points. So I needle St. Joe 3 and 10, pericardium 7 and 3, liver 3 and 8, and gallbladder 41 and 34. And then I wanted also to focus a little bit on the area that are really discomfort for her. So I used large intestine 5 Usher, which is at the wrist here, to balance the throat, the ball at the throat on the stomach meridian. And this is I needle Usher point, and this is by the direct puppet show image. I also used stomach 36, which is a good projection of the stomach area on the stomach meridian, and this is by the reversed puppet tibia image. And also it's a good projection of the area above and below the umbilicus, and this is by the direct and reversed puppet show image. So that's what I did on the patient, and I saw her about 2 weeks later. She couldn't come in between because my calendar was full, and she also was away, so it was difficult for her to come immediately if I had any cancellation. So after those 2 weeks, she said she really felt a huge change on her head and belly itching. She said she almost has no itching anymore. So she was really, really happy on that. She said the ball on her throat disappeared for about 24 hours, and then it came back. And the other thing is regarding the heaviness. She said it was much better, and it started to come back 2-3 days before the second appointment, and her digestion is overall smoother. She doesn't have bloating, and of course it's not perfect yet, but it has improved a lot.